Assalamualaikum and hello everyone. Today I will be talking about the role of an ophthalmologist, the anatomy of the eye, the biochemical process of vision, and a common condition that affects our eyes, which is cataracts, including its causes, symptoms, and treatment. So for introduction, ophthalmologists are medical doctors specializing in ophthalmology, a branch of medicine focused on diagnosing, treating, and managing disorders of the eye and vision. Their ultimate goal is to ensure that our eyes are healthy and functioning properly, such as preserving vision, restoring vision, eye health maintenance, managing systemic conditions, and providing corrective solutions like prescription glasses or contact lens. And there is some amazing facts about our eye, like our cornea is the only tissue in the body that does not have blood vessels. Our eye also is the fastest muscle in the human body, and the human eye can differentiate about 10 million different colors. To understand this better, we must first appreciate the anatomy of the eye and how it works. Now, let's move on to anatomy of the eye. The human eye is a complex and fascinating organ. Each part plays a crucial role in enabling vision. Let's break it down. First, we look into cornea. It's like a windshield that protects the eye and helps bend light as it enters. As we can see in this picture, the cornea has Bowman's layer, epithelium, stroma, disseminate membrane, and endothelium. Next, sclera. Sclera is the white parts of the eye, provides its shape and structure. And conjunctiva. This clear layer lines the sclera and eyelids. Aqueous humor. It's a fluid that maintains the eye's shape by creating pressure. For iris and pupil, the iris controls the size of the pupil, which acts like an adjustable window to control light entering the eye. Lens. It focuses light into the retina. There are three layers in lens, which include lens capsule, lens epithelium, and lens fiber. Vitreous humor. It's a gel-like fluid that maintains the eye's shape. And so on. Retina is a thin layer at the back of the eye that converts light into signals using specialized cells, which is rods for low light vision, and cones for color vision. And we will further explore these parts in biochemical process. Macula, the central parts of the retina that helps us see details and color. Optic nerve, it transmits visual information to the brain. And the last one, external muscle. This control eye movement and allow us to focus on objects near and far. This anatomy works together seamlessly to give us clear vision, but how does this work on a biochemical level? Let's discuss the process of phototransduction. In biochemical process of vision, the retina contains photoreceptors, which have specialized cells that convert light into electrical signals in a process called phototransduction. Here's how it works. The first stage, first light absorption, light hits the photoreceptors, rods for dim light and cones for bright light and color. Rhodopsin, which is in rods, and other photopigments absorb light. And second, activation. When light is absorbed, rhodopsin undergoes a structural change, activating the molecule. The third, signal amplification, which the rhodopsin triggers a cascade of chemical signals involving the G protein called transducin. In the fourth stage, ion channel closure. This chemical reaction causes sodium channels to close, changing the electrical states of the photoreceptor. And the last stage, which is signals transmission. This change reduces the release of the neurotransmitter neurotransmitter glutamate, which sends signals to the bipolar and ganglion cells. These signals are then sent to the brain for interpretation as vision. Now, we understand how our eyes function. Let's move on to a condition that affects millions of people: cataracts. Cataracts occur when the clear lens of the eye becomes cloudy, preventing light from passing through properly. So most cataracts are age-related, but other factors can contribute as well. And the symptoms of cataracts including blurry or cloudy vision, colors appear faded, difficulty seeing at night, and as well as sensitivity to bright lights and halos around them. For risk factors, aging the most significant cause, and UV radiation, long-term exposure to sunlight. Just like UV rays from the sun can harm our skin, they can also cause significant damage to our eyes over time. Here's how it can happen: cataract formation. UV rays, especially UVB radiation, can break down protein in the lens of the eye. This protein damage causes the lens to become cloudy, leading to cataracts over time. So people with frequent unprotected exposure to sunlight are at a high risk. And smoking. Chemicals in tobacco damage the eye lens, as we all know that. And for diabetes, its elevated glucose affects the lens. Or don't forget that family history genetics can play a role. And eye injuries or surgeries, damage can lead to cataracts. Next, corticosteroids. Long-term use can elevate risk. And obesity links to diabetes, which increase cataract risk. So how cataracts can occur? Cataracts occur when proteins in the lens break down due to aging, damage, or oxidative stress. These proteins clump together, creating cloudy areas that scatter light and blur vision. Okay, let me take a breath first. Okay, the most effective treatments for cataracts is cataract surgery, specifically phacoemulsification. In this procedure, first an ultrasound probe breaks the cataract into small pieces, and the damaged lens is removed, and an artificial lens implant is placed inside the eye. To visualize the procedure clearly, we can refer to this video. For our information, cataract surgery is one of the safest and most successful operations, with over 90% of patients reporting improved vision after the procedure. So, in summary, ophthalmologists play a vital role in diagnosing and treating eye conditions like cataracts. Understanding the anatomy of the eye and the biochemical process of vision helps us appreciate how our eyes function. Cataracts, so common, can significantly impact quality of life. Fortunately, with advancements in surgery, treatment is both safe and effective. And now, ladies and gentlemen, I would like to talk about our specialists in this field. I'm honored to speak about Dr. Ilian Chong, a highly respected ophthalmologist who has made incredible contributions to eye care. Dr. Chong specializes in cataract and corneal surgeries as well as treating retinal conditions. She currently leads as the head of ophthalmology at the Royal Melbourne Hospital and works as a consultant in both the corneal and retinal units at the Royal Victorian Eye and Ear Hospital. Beyond her clinical work, Dr. Chong is also a dedicated researcher. She has published over 40 peer-reviewed studies and her work has earned international recognition, including the prestigious Young Investigators Merit Award at the Asia Arbor Scientific Meeting. So the incredible life and outside the Malaysia, I also want to highlight Dr. Patricia Betts, a true pioneer in medicine, an inventor, a humanitarian, and a champion for equality. I like to briefly talk about the life of Dr. Patricia Betts, a groundbreaking American ophthalmologist. Born in 1942 in Harlem, New York, she faced many challenges but became the first African American woman to complete a residency in ophthalmology. Dr. Patricia Betts is best known for inventing the RAZAQ probe, a device that transforms cataract surgery and restores vision to millions of people. She founded the American Institute for the Prevention of Blindness, advocating for equal access to eye care. Dr. Betts' work showed the power of innovation and compassion, providing that we can make a difference no matter the obstacles. Thank you for your attention, and I hope you have gained valuable insights into the incredible complexity and care of the human eye.